And in Gaza, here you might say, oh, what's the big deal? She's got some wounds on her feet. But what she's living in is actually roads that are just full of sewage because there's no bathrooms, there's no infrastructure, nothing. And she will get infected and her feet will have to get amputated. So many of the children that we saw there ended up with amputations with no prosthetics, no rehabilitation, no ground to even try to walk on. These are two such girls, sisters sharing a wheelchair. Their parents died in the same attack that they ended up being amputees in. And their only chance for survival is to be medically evacuated. Unfortunately, the current security restrictions don't allow for children to travel with more than one caregiver. It would be great if that caregiver was a parent, but most of the children don't have parents left. Their caregiver is their aunt, who has a baby that she is breastfeeding. So even though we were able to, with great difficulty, get evacuation set up for them, they won't let the aunt take her baby with her. So the aunt has to choose between the baby she's breastfeeding and the lives of her two nieces. If we do get her to be able to evacuate, the other thing she worries about is that will she be allowed to return? Currently, even for medical evacuations, there's no right of return for Palestinians to come back to Gaza. These are all problematic issues that are created from false dilemmas. This is just humanitarian aid. These are children, these are women, these are babies that we need to be able to help in order to have peace and prosperity in the entire region. Thank you.
Hi, my name is Feroze Sidhwa. I'm a trauma surgeon in California. I was in Gaza from March 25th to April 8th of last year. After I came back, I wrote a New York Times article about what 65 American doctors and nurses saw when they were in Gaza. And I've worked in plenty of other places. I've worked in Ukraine with State Department USAID funded work. I've worked 3 times in the past year and a half. I've worked in Haiti, I've worked in southern Zimbabwe. I've worked in Burkina Faso, which is one of the poorest places in the world. And just to echo what Mimi and Ayesha said, I've never seen a place like Gaza in my life. It's dramatic what's been done. And as physicians, as physicians, we work in hospitals with our healthcare colleagues, and we've seen both the institutions, the hospitals themselves, and our healthcare colleagues absolutely decimated by this attack. The hospital system has been attacked so directly, and each individual hospital has been attacked and ransacked so many times that now, even though a new facade can be placed up on the outside, am I doing this wrong, Sarah? Even though a facade is placed on the outside of the building and new paint is put on or whatever, that doesn't replace the CT scanner that was destroyed. It doesn't replace the X-ray machines. It doesn't replace the simple things like EKG machines. It doesn't replace all the IVs that were burned, things like that. The critical lack of not only disposable medical equipment, but the larger things like a CT scanner or a functional operating room is a major problem. When I was at European Hospital, this was in a relatively good time, March and April of last year, there were 250 people, half of them small children, who needed daily operative wound care at European Hospital where I was. 250 people, half of them small children. There's only 4 ORs at European Hospital. How can I take 250 people to the OR every single day in a place with 4 operating rooms? It's impossible. So these dilemmas and the extreme need compared to the very minimal capacity that's left is why we're emphasizing medical evacuations. There's about 2,500 children who are at imminent risk of death in the next few weeks. Some are dying right now, some will die tomorrow, some will die the next day. But in general, this group of 2,500 kids, that's out of a group of 25,000 people in Gaza who need to be medically evacuated. But of those 2,500 kids, the vast majority need very simple things done. For example, we have a case of a 3.5-year-old boy whose arm was burned, and he actually healed from the burn just fine. But when you have a burn that is circumferential on your arm, it starts to act like a tourniquet, especially as the scar tissue forms, and then it squeezes down on the tissue. So he's not getting blood flow to his hand anymore, and it's just slowly getting worse and worse and worse. Eventually his hand will die. Well, he's a small child. He doesn't understand that he has to protect his hand at all costs, because the slightest nick he gets on it now is going to lead to an infection that either leads to his arm being amputated or him dying. And this is a perfectly common, there's a perfectly standard example of what's going on. It's not extreme at all. The care he needs could be done in any third world healthcare system, but because Gaza has been so wrecked, it's not possible to do it there. And in addition to the facilities being smashed and then not restocked properly, the healthcare workers themselves have been taken en masse. 1 out of every 20 healthcare workers in Gaza is dead. That's what's known. It's very likely that it's actually significantly higher than that. My own rough estimate is that 1 out of 10 have fled Gaza for obvious reasons. And then another 600, which comes out to about 1 out of 30, are in Israeli prisons, including 250 physicians, most of the subspecialists that are left in Gaza, et cetera, et cetera. So not only have the facilities been destroyed, but the human capital, the human resources, and these were the people who were head departments. These were the oldest surgeons and doctors in Gaza, people with experience, people who knew how to run the system. They are again dead, fled, or in prison, in an Israeli prison. So the necessity of getting both the severely injured children out so that they can have, and not just children, adults too, but the children are the focus usually, out so that they can be treated and don't die or become unbelievably crippled unnecessarily, and at the same time allowing physicians from outside of Gaza to go in, physicians and nurses, to fill that gap while those Palestinians are allowed to return or are released from prison and then are retrained to replace the dozens and or the 1,000 that are dead, is absolutely critical, and that's also being blocked in various ways, and that's what we talked about with Secretary General Gutierrez, and thankfully he was very receptive to that.
Problem worldwide. I want to highlight the case of Dr. Adnan Bush, famous orthopedic surgeon at Shifa Hospital. I worked at Shifa Hospital prior to October 7th. Dr. Bush was tortured to death. His body left in the compound of Al-Far prison in Ramallah, the same prison where my uncle is being held, a 55-year-old Palestinian picked up after October 7th. No charge, no lawyer access, just in prison because he's Palestinian. I want to mention that these, and my colleagues can testify to this, we have some of the most incredible, brilliant physicians in Gaza, Palestinians ready to serve Palestinians. But even wearing a white coat was deadly. So why do we need medical evacuations? It's because not just the healthcare system was targeted, but the doctors, the nurses, the paramedics, the first responders, they were targeted, they were killed. I do want to mention Dr. Hussam Abu Safiya, forcibly disappeared. I spoke to his son yesterday. Dr. Hussam has lost everything. Dr. Hussam wrote 2 op-eds in the New York Times. Dr. Hussam has interviewed with countless media. And when the Israelis for the second time decided to surround Kamal Adwan as early as October of 2024, he refused to leave the pediatric patients. This was the hospital that he built. Those were the departments that he helped develop. And he refused to leave. And his son was killed because of that. He buried his son Ibrahim in the courtyard of Kamal Adwan Hospital. And then he watched the military raid the hospital, destroy it. And he had to be injured in that process. And then he had to walk up to a tank in his white coat and shake the hand of the military that killed his son and injured him. And we haven't heard from him since. They've confirmed that he's in the prison, but there's no charge. They've confirmed that he's in the prison, but there's no court date. And so Dr. Hussam is representative of the attack on healthcare workers. We need him out. He needs to be leading this response. Palestinians need to lead the response. Palestinians need to be treating Palestinians. And we need to be...
Michelle Nichols from Reuters. Apologies, I was late when briefing downstairs. So if you've already answered this, just tell me and I'll go back and watch it at start. Can you just clarify a little bit what you were saying about the medical evacuations since the ceasefire started, sort of how many have there been? Is that and forgive my ignorance here with everything that's going on, under this phase of the ceasefire, is there a sort of certain number that is supposed to be taking place, or is this coming in a later phase?
There is, under this ceasefire agreement, there is supposed to be a mechanism in place for medical evacuations. We've still not seen that process spelled out, which is what we are talking about. We've even heard that there are supposed to be 50 injured combatants during a ceasefire phase 2 deal where they are able to exit through the Rafah border crossing, which is currently shut down, with 3 companions, which actually underscores a very important point here. If injured, wounded from fighting are able to exit with 3 companions, then kids with their parents or relatives, because their parents are dead, should pose no security threat, and that should be expedited. So that's part of the process, is can we have something defined here so it can be reliable, consistent?
Yeah, I think what we're trying to underline here is that we need a more centralized approach to this, because we need efficiency, and of course that's understood given the bombardment and the utter chaos that's been going on for the past 15 months. But I think now is a good time to take a breath and try to organize the pathways for medical evacuation.
Sorry, just a quick follow-up. And at what level, like, who's controlling these discussions? And you mentioned the sisters with the arm. Like, how many cases are there like that where they've decided not to leave?
Yes. Sorry. No, so the process is multiple. There's multi-pronged process. But so, for example, for Mira, the little girl I just showed, we have a hospital in the U.S. that's willing to accept her. We have housing, we have funding, we have a surgeon to accept her. But Kogat, which is the Israeli security, has not cleared her to leave with her family. Meanwhile, she's been waiting, and now her mother has been injured again with shrapnel and has an amputation of her own leg. So that's now affecting the primary caregiver, and it completely complicates the entire situation. So the speediness of it is important for that very reason.
There's 2,500 children that imminently need to be evacuated or will die in the next few weeks, and there is no process in place at all to get them out. There's not even a discussion of who can accompany these children, if they have small babies themselves, are they allowed to take them, and will they be allowed to return? There's some discussion right now of the Rafah border opening only for exits, but it's exit without right to return. If you only allow one caregiver out with the children that they're taking care of, there's no way that they're going to be able to come back to their own families as of now. To answer your question about how many children are there that were able to have evacuation set up and could not follow through, it's really difficult to say, because it's only a handful of children that were even able to have the process put into place with everything that is needed from the outside. And I think, there's so much misinformation to the people of Palestine about whether they'll be able to come back, who can go, that there's mass chaos around this issue and other issues. I just want to mention that we know that chaos in a medical system increases mortality by 30%. Just by creating confusion, uncertainty, chaos, you are creating a 30% more effective killing machine. And this is exactly where the Secretary General, the UN, organizations can help, because organizations bring organization. And what we are advocating for very strongly is to have a centralized process, clear guidelines, and to have COGAT put in writing what is needed, both for what can enter into Gaza and what is needed to exit.
Thank you.
Yeah, the
Degree of strength that you need to be able to get up every day, come into the hospital, see mass casualty incidents where your emergency department is flooded with patients, more patients than the number of doctors can handle, and your hands are tied behind your back because you don't have the simplest things to take care of them. The last day that I was there, they had one laryngoscope. It's an important tool that we intubate with, put in a breathing tube with, and it has a light on it so that when you're in the mouth, you can actually see where the vocal cords are. The C battery, which powers it, died. And you would think like, oh, what's the big deal? Get another battery. Batteries are not allowed in. So the doctors that are working there are trying to put together whatever tools they have to continue working, the few doctors that are left. And my biggest concern is half of my friends that were doctors working with me have now gone back to the north. And there's a lot of uncertainty about what they're gonna find. But in true Palestinian doctor fashion, they are all trying to go back to Shifa Hospital, which is the hospital in the north, and try to work there.
And I will add to that I asked a doctor in the north, a doctor in central Gaza, a doctor in South Gaza to brief me before we had our meeting with the Secretary General and Tom Fletcher, the chief of OCHA, as well as these bilateral nations, of what they needed, what should be prioritized. None of them said that we need to start getting paid. None of them said that we need more doctors or nurses. They wanted the support. They wanted hospital beds, they wanted monitors, they wanted things that would fit onto the fingers of children. These are the things that they were asking for. In addition to saying, while we're building that up, please, the people that are on this list that are ticking, that there is an urgent need to get them out, that they could die while they're waiting, please help them get the care that they need.
A few more, Batu.
Hi, Betty CNBC Turkey here. Sorry, I arrived a little late, and you could just skip that part if you have already answered. I just wonder what kind of impact it will have for like the U.S. withdrawal from the World Health Organization on the healthcare workers in Gaza. And as doctors, I also wonder if you have any response or anything to say to the recent claims by the White House, by President Trump himself, that he stopped $50 million funding for Gaza, which he claims to be used to buy condoms, and he also claims that that funding, the condoms would be used to make bombs. And your doctors, do you have anything to say on that claim as well?
This is nonsense, and it's a distraction from the true horrors that are happening on the ground. And even with some of our senators and congressmen and congresswomen who we met with, even they recognize the ludicrous nature of this sort of language dominating the airwaves. I mean, it's totally unacceptable to be focusing on these sorts of things, and there's nothing that suggests that is even in the realm of reality. What I will say about the WHO, the US withdrawing funding from it, it's not just that this massive institution that is helping deliver care and increase capacity and capabilities will lose its funding, meaning that people will die. It's that effect will travel downstream. It'll travel to other agencies, it'll travel to international NGOs, and it will hinder the ability for people to mount aid. The pool of resources becomes smaller, and that means that the beneficiaries down the line will suffer.
I just want to add, that sets a very dangerous precedence for NGOs, and just like Dr. Thayer said, I mean, this is something that's absolutely inhumane. It's against humanity, and it is a complete breach of humanitarian law.
Yeah, just to emphasize how we really shouldn't pay attention to these silly distractions from this or that place. Ukraine used to be the most dangerous place in the world for children in armed conflict. If you look at the population-adjusted rate of killing of children in Gaza versus Ukraine, it's about 600 times higher in Gaza. 80% of housing stock in Gaza has been destroyed. The entire sewage system has been destroyed. There's no clean water. There's infants are dying of hypothermia. If someone wants to talk about condoms, that's their business, but the rest of us should just not pay attention to that kind of thing.
Just maybe two more. They have to run to a meeting. Go ahead, Ibtisam.
Hi, my name is Ibtisam Azim, Al-Arabi Al-Jadid newspaper. I have a couple of questions. One, if you can talk to the issue of pregnant women and newborns, if you were able. I know we're in emergency, but if you could say more to that, if you were able to, and also to patient like cancer patient, what happened with so-called normal and do you have any percentage of how many international or doctors and healthcare workers were denied entry by the Israelis? Thank you.
Okay, I can take the beginning part of your question. So the hospital that I was in, UNCA Hospital, was a maternity hospital prior to October 7th. Because of the destruction of all of the hospitals, it had to be converted into a primary trauma center. all of the maternal health care that happened there is no longer functioning there. Women do get pregnancy care. It is limited because there's like no prenatal vitamins. There's a limited number of ultrasounds. As physicians, we weren't allowed to take in our own ultrasounds. When there was crossing through the Rafah border, Egypt allowed a lot of suitcases. I went in through Israel with Kogat. I was allowed one suitcase in which I could have nothing that wasn't for my own personal use. I smuggled in 3 months of chemotherapy medication for a child that I was asked to carry. To your point, cancer care, all of the non-communicable diseases, everything that isn't primarily imminent trauma has been pushed to the wayside, and we have not even started to realize the deaths and destruction that is going to cause. When you get a death toll, when you get a number from the Ministry of Health, those are people who were killed by an explosive or by a bullet. The truth of actually how many people were killed is probably 5 or 6 times that number. And there are people who are still dying. Mimi and I saw a woman who had a large breast mass. There was a breast surgeon available at the hospital that we were at, and there were only 3 operating rooms, and they had to keep them open for trauma. So the situation is dire for women, for maternity, for newborns, for cancer care.
I just wanted to add the prenatal care. There's prenatal care, but this is an example of the insidious annihilation of this population. I'll give you an example. I saw over and over again women who came in with preterm infants, children who were born early because mother was hypoxic, meaning she didn't have enough oxygen in her lungs and her bloodstream, so she gave birth early. And that child suffered from cerebral palsy and all sorts of medical conditions for the rest of their life. Those are debilitating conditions because of the environmental disaster that is happening, and that we'll continue to see. All of us will continue to see the environmental disaster of residue from bombs, God knows how many heavy metals in the air. So this is not something that's going to go away because there is a ceasefire. We have to all continue to pay attention because the work has just begun.